Hello, good day everyone. I am Guadalquiver from the SN11G Group 27, and so for today, I'm going to perform a proper demonstration about complete bed bath. So bed bath means washing someone who is in bed. It is important to cleanse the skin, and it helps the skin to prevent getting infected, and also it will make the patient feel more better. Determine the scope of the assessment and prepare the equipment to be needed. So we have the wash towel, and we have the blanket towel, and the washcloth, the alcohol, the lotion, deodorant, the patient's gown, the gloves, and soap, which is optional, and also the basin with full of warm water. And also, don't forget to perform hand hygiene in order to prevent in getting microorganisms. Close the door and fix the curtains, and also adjust the room temperature and provide adequate lighting for patients' comfort and privacy. So, hello, good day, ma'am. How are you feeling today? Okay, that's great. So it is important to meet the patient in order to establish a good rapport between the healthcare provider and to the patient. So, ma'am, let me introduce myself to you. I am Guadalquiver and I am your student nurse for today. So, may I know your full name, please?
I am Crisantero Caparos.
Okay, when is your birthday?
October 8, 2003.
Okay, how would you like me to call you?
Please.
Okay, so what language do you prefer? Do you prefer English or Bisaya?
English.
Okay, so Ma'am Chris, the procedure that I'll be doing is I'll be doing a bed bath. This is done to remove dirt in your body, and also it will help you to feel more better, and there is a certain procedures that you need to follow. Is that okay with you?
Sure.
Any concerns or questions?
That's all.
Okay, great. So it is important to explain the procedure of the assessment to the patient so that they will know how can they participate on the assessment. So first and foremost, before doing the assessment, wear working gloves. Okay, and offer the patient with a bedpan or urinal and ask the patient if he or she wants to void. So, Ma'am Chris, do you want to void first? Okay. So, bring the necessary equipment and wear correct PPE. So, raise the bed into a convenient working height and lower side rails near the nurse. Assist the patient to the side of the bed. So, Ma'am Chris, can you go here at the side, please? Okay, thank you. So, place the bath blanket over the patient and remove the soiled top sheet beneath and place it into the hamper. Can you touch this for me, please? Remove the patient gown if the patient has intravenous line, injury, or reduced mobility, and begin on the unaffected side. So, can you slide this? And also fill the basin with 2/3 full of warm water in 43 to 46 degrees Celsius and check the temperature of the water. And also let the patient check the temperature of the water and make sure that the patient can tolerate it. So can you touch this water, Ma'am Chris? Is the temperature good?
Yes.
Okay. And remove the patient's pillow if the patient conditions allows and raise the head of the bed into 30 to 45 degrees. First is we will wash the face. So place the towels appropriately. So the first towel is under the patient's head and the second towel is over the patient's chest. Wash the client's eyes with water only and dry them well. Use a separate corner of the washcloth for each eye and ask whether the client was once soap used on the face. So, Ma'am Chris, do you want to apply do you want to apply soap on your face?
No.
Okay. And pat it to dry. Wash, rinse, and dry the client's face, ear, and neck, and ask the male patient if he'd like a shave. So now, I'm gonna wash for the arms and hands. Expose the patient's forearm and place the bath towel lengthwise beneath the arm. Wet soap, rinses and dry, then covers, and then place the bath towel lengthwise, and also wet soap, rinse and dry that covers the arm and axilla from distal to proximal. Can you lower your hand? And apply deodorant for the patient's axilla. And pat it to dry. And repeat it to the other arm. From the hands to the axilla in a distal to proximal motion, also apply deodorant for the and put it to the patient's axilla. And pat it to dry. Wet soaps, rinse and dries the hands and the nails, and does the same other arm in steps 14A to 14C. Wash the chest and abdomen. Spread the towel across the patient's chest while lowering the blanket to the umbilical area. Lift the bath towel off the chest and bat the chest and abdomen with your mitted hand using long firm strokes. Give special attention to the skin, under the breast, and any other skin folds, particularly if the client is overweight. Rise and dry well. And pat to dry. For female patients, cleanse and dries the skin beneath the breast. Checks and change the water as necessary, and drapes the patient's chest and abdomen using a towel or blanket. Wash the legs and feet. So expose the patient's leg farthest from you by folding the bath blanket towards the other leg. Being careful to keep the perineum covered, and place the towel lengthwise under the leg. Wet soaps, rinse and dries the patient's farther leg from a distal to proximal manner, and wash and dries the patient thoroughly and applies lotion to the foot. And reverse the coverings and repeat for the other leg. And pat to dry. For the other leg, please. Discard the washcloth and maintains patient privacy, and also refill the basin with clean water. So I already changed the the pair of gloves, and applies perineal care as necessary, and also change the water and applies a clean pair of gloves. So now I'm going to wash for the back. So assist the patient into a prone or sideline position facing away from you, and place the bath towel lengthwise alongside the back and buttocks while keeping the client covered with the bath blanket as much as possible. Okay, so ma'am, can you do a sideline position? Okay. And wash and dry the client's back, moving from the shoulders to buttocks and upper right, paying attention to the gluteal folds. And pat it to dry. Okay, you can lie down now, ma'am. If the patient's skin is intact, remove and discard the gloves if used. Perform a back massage now or after the completion of bath if patient prefers. So help the patient to put a new gown and check the device attached to the patient. Kindly. Then you slide it into your other arm. And put the blanket to the patient. And combs the hair properly. So how are you feeling, Ma'am Chris? Okay, that's great to hear. And perform hand hygiene and assess the patient after the procedure. And prepare documentation and reports for any pertinent observations. And that's for the complete bed bath assessment. Thank you.